What is Raas system and how is kidney involved in long-term blood pressure regulation? These are the questions we are going to discuss in today's video. Hello students, I am Dr. Faisal and you are watching Ocean Classes. Let's get started. Long-term blood pressure regulation. Long-term blood pressure regulation, it is done by kidneys. Number one. Number second thing, it works when short-term fails. And number third thing, it regulates blood pressure by regulating ECF volume. What is this ECF volume? ECF means extracellular fluid volume. So basically kidney, it is involved in blood pressure regulation by regulating the amount of fluid that is present in our body. अगर बॉडी में फ्लूइड ज़्यादा होगा तो ब्लड प्रेशर ज़्यादा होगा और किडनी उसको बाहर निकालने की कोशिश करेगी इफ़ इट इज़ नॉर्मली फंक्शनिंग, और अगर बॉडी के अंदर फ्लूइड कम होगा तो ब्लड प्रेशर कम होगा, तो किडनी ज़्यादा से ज़्यादा पानी को बचाने की कोशिश करेगी बाय फॉर्मिंग कंसंट्रेटेड यूरिन. This is in nutshell how the kidney it helps in the long term blood pressure regulation. To understand this concept in details, we need to have a concept of nephron. That is a functional unit of kidney. Kidney का जो functional unit है जो actually में काम करता है that is nephron. तो उसके बारे में थोड़ी सी बात कर लेते हैं. Nephron, if we see, it has different parts. It has a Bowman's capsule. It has proximal convoluted tubule. It has loop of Henle. It has distal convoluted tubule and a collecting duct. And this red portion, this is the very important portion, very important portion. This is known as glomerulus. Okay. Let me tell you few points regarding all these segments of nephron. This glomerulus, it is involved in the filtration process. This whole loop, it is involved in tubular reabsorption and the tubular secretions, and the final urine, it comes through these collecting ducts and it goes out. सबसे पहले क्या होता है, यहाँ से blood आ रहा होता है. This is blood which is coming. This is the renal artery. Renal artery के through blood आ रहा होता है, and ultimately it enters the afferent arteriole. This is very important. This is afferent, A for afferent, and this is efferent arteriole. E is exit. The afferent arterioles come, they form a loop of capillaries here known as glomerulus, and then they go out in the form of efferent arterioles. Okay, so this glomerulus, this is very important. This is a tough capillaries, and what happens here at this tough capillaries, जो blood यहाँ से आ रहा होता है उसका nearly one fifth of the blood that is coming here, it is filtered. Filtered का मतलब जो उसमें प्लाज्मा होता है, it comes out. जो पानी होता है और पानी में जितनी भी डिसॉल्व चीजें होती है, they come down in this glomerulus, in this Bowman's capsule. So what happens, the blood comes, it is filtered, and the plasma, it comes here in this Bowman's capsule. Rest of the blood, it flows to the efferent arteriole. Now 1/5, that is the blood which comes in this Bowman's capsule. What happens to this? This fluid which comes here, it has both useful as well as waste things in it. इसमें useful चीजें भी है और इसमें waste भी है. What we need to do, we will move this fluid through this tube or through this tubule, and what this tubule will do, it will reabsorb the useful things, okay, and will let the waste go out of the body. One more thing, when the fluid it is moving through this tubule, at some places there will be additional secretions in the tubule. This is what I want you people to know, that there is a process that is known as filtration or ultrafiltration. The blood comes, it is filtered here, and then the filtrate, it moves through the tubule, through proximal convoluted tubule, loop of Henle, distal convoluted tubule, and ultimately goes into the collecting duct. When it is moving, useful things are continuously moved out and additional waste is continuously being added, and in this way our final urine will be formed. Okay, this is the basic thing. Now you answer me, if there is decreased blood pressure in the body, when there will be decreased blood pressure in the body, the blood flow to the kidney will be less. When blood flow to the kidney will be less, there will be decreased filtration. One thing, whenever there is decreased blood flow, to the kidneys, it will result in decreased filtration at the glomerulus. And the filtration which happens at glomerulus, it is known as GFR, glomerular filtration rate. I want you to remember this term, that whenever blood pressure will fall, it will cause decrease in the GFR. And when GFR will decrease, what will happen? Less filtrate will be formed, and when less filtrate will be formed, accordingly the urine formed, it will be less. जो urine बनेगा वो less होगा. Okay? How the kidney works in long term blood pressure regulation, let's understand with the help of Raas system. Okay, first thing, what is the full form of Raas? Raas stands for renin, angiotensin, aldosterone system. Okay, there are three things: renin, angiotensin, and aldosterone. S stands for system. First, we need to understand these three terms. What is meant by renin, what is angiotensin, and what is aldosterone. All the three things, they are basically hormones which are involved in this Raas system. Renin, it is released from afferent arterioles of kidney. Where from this renin comes? It comes from the kidney. And from where? It comes from the afferent arteriole. And if we see exact location, it comes from JG cells of kidney. Okay, JG cells are nothing, they are modified smooth muscles. Okay, what is angiotensin? Angiotensin, it is present in the form of inactive molecule called as angiotensinogen. And this angiotensinogen, it is always present in the blood, but it is in inactive state, and it is secreted by liver. Liver helps in the formation of this angiotensinogen. And what about this aldosterone? This aldosterone, it is released from adrenal gland. What is this adrenal gland? हमारी किडनी जो है, इसके ऊपर एक छोटा सा ग्लैंड है ऐसे, जिसको हम लोग एड्रीनल ग्लैंड बोलते हैं या सुपरा रीनल ग्लैंड बोलते हैं. एड्रीनल और सुपरा रीनल ग्लैंड. सुपरा मीन्स अबव किडनी. ओके, सो एड्रीनल ग्लैंड और सुपरा रीनल ग्लैंड, especially adrenal cortex. This aldosterone, it comes from adrenal gland, and adrenal gland, it has two parts. Outer one is known as cortex and inner one is known as medulla, and this aldosterone, it comes from adrenal cortex. Okay, so we have three hormones: renin coming from the kidney, angiotensinogen coming from the liver, and aldosterone coming from the adrenal cortex. Okay, how they work, what are their functions, we will discuss shortly. Okay, let's understand this Raas system now by taking example of decreased blood pressure. When there will be decreased blood pressure in the body, it will cause decreased renal blood flow. Okay, blood pressure कम हो जाएगा, किडनी का blood pressure कम हो जाएगा, किडनी का blood flow भी कम हो जाएगा. And when there is decreased renal blood flow, it will cause decrease in GFR. How? I have already explained you how this GFR, it is going to decrease. Okay, GFR, it will decrease. When there is decrease in GFR, there is decreased sodium load to macula densa. Now what is this macula densa? Let me go to the previous diagram. Macula densa is a small sensor which is present in the distal convoluted tubule. A loop of Henle tha, this is distal convoluted tubule. Here is a small sensor that is known as macula densa. It continuously checks the sodium levels of the urine. अगर यहाँ से filtrate कम आएगा, if there is less filtrate, there will be less sodium here, because most of the sodium, it will be reabsorbed, and there will be less sodium to the macula densa. And when there will be less sodium to the macula densa, it will give signal to the JG cells. I know you people will be knowing this time what are JG cells. It will give signal to the JG cells, and the JG cells, they will cause release of molecule that is known as renin, and this renin, it will come in the blood. Okay, there is decreased blood pressure, it will cause decreased renal blood flow. When renal blood flow decreases, it will cause decrease in the GFR because filtration is happening less, and when less filtration is happening, there is a decreased sodium load to the macula densa because maximum portion reabsorb ho gaya, and macula densa gives signal to the JG cells, and JG cells release renin. Okay, this renin, what it does, it converts angiotensinogen, which was inactive in the blood. It converts this angiotensinogen into angiotensin first. This is a very important step. So renin comes in the blood, it converts the inactive angiotensinogen into angiotensin first. Then this angiotensin first, it goes to the blood circulation and it gets converted to angiotensin second. How it gets converted to angiotensin second? With the help of enzyme that is known as ACE, angiotensin converting enzyme. It is present in lung capillaries. It is present in lungs. Okay, again let me make it clear for you. There was decreased blood pressure, which causes decrease in renal blood flow, which causes decreased GFR. When GFR decreases, there is decreased sodium load to macula densa. Macula densa sends signal to the JG cells, and JG cells release renin. It converts angiotensinogen into angiotensin first. Angiotensin first is converted into angiotensin second with the help of enzyme known as ACE, which is present in the lungs. Now this angiotensin second, this is the most important molecule. Mark it. It is very important molecule, and it is the most important molecule of the Raas system because this angiotensin second, it performs three functions. This angiotensin second, it performs three functions. What are the three functions? Number one, it causes direct vasoconstriction. It acts on the blood vessels and causes constriction of the blood vessels. Okay, and when blood vessels they are constricted, it increases blood pressure. This is a very fundamental thing, you will be knowing this time. Second thing is, it goes to the adrenal cortex and causes release of aldosterone. Okay, it goes to adrenal cortex, causes release of aldosterone. And third thing, it goes to the hypothalamus of the brain and causes the release of a molecule known as ADH, antidiuretic hormone. Causes release of aldosterone and it causes release of antidiuretic hormone. Okay, aldosterone and ADH, they are again two very important molecules which help the angiotensin second to work. How aldosterone works and how ADH works, let's understand in more detail. First, aldosterone. Aldosterone, number one, it increases sodium reabsorption. It causes reabsorption of sodium, and wherever sodium goes, water goes with it. अगर सोडियम reabsorb हो गया तो सोडियम के साथ साथ पानी भी जाएगा. So it also helps in the water reabsorption. Okay, it reabsorbs sodium, and along with the sodium, water also moves. But sodium has a positive charge. Okay, sodium has a positive charge. In order to maintain the electrical neutrality, it throws out potassium instead of the sodium. And if potassium is less, it can throw out H positive also. So aldosterone excretes potassium and hydrogen. Basically, there is a transporter in the tubule. If this is a urinary tubule, there is a transporter which takes sodium in and it throws out potassium and H positive ions. Okay, this transporter, it is activated with the help of aldosterone, and wherever sodium goes, water also goes. Okay, second thing, ADH. ADH, when it is released from the posterior lobe of pituitary, it does two things. Number one thing, it causes vasoconstriction, and number second thing, it causes water reabsorption. Since it causes direct vasoconstriction, sometimes it is also called as vasopressin because it is pressing the vessels. It is also called as vasopressin because it presses the blood vessels. Second important thing, it helps in water reabsorption with the help of some tubules known as aquaporins. Okay, and both these things, if we see, vasoconstriction and increased reabsorption of water, they help in increasing the blood pressure. And here if we see sodium and water reabsorption, it also increases in the blood pressure. So coming back to the cycle, we formed angiotensin second, which causes direct vasoconstriction, causes release of aldosterone, and this aldosterone, what it does, it increases blood pressure. How? By sodium and water reabsorption. And ADH also increases the blood pressure. How? By direct vasoconstriction and water reabsorption. Okay, all the three factors, if we see, increased vasoconstriction, increased aldosterone, increased ADH, they all are increasing the blood pressure. When they all increase the blood pressure, it is going to bring blood pressure back to normal. Okay, this is the cycle how Raas system operates. First, there is decreased blood pressure, which causes decreased renal blood flow, which decreases the GFR. When GFR decreases, macula densa sends a signal to the JG cells to release renin. Renin acts on the angiotensinogen to convert it into angiotensin first. Angiotensin first is converted to angiotensin second, and angiotensin does all the function. That is, it causes vasoconstriction, it causes sodium and water reabsorption, it causes vasoconstriction and water reabsorption. All these three things, they increase the blood pressure either by the vasoconstriction, either by increasing fluid in the body. Okay, all the three things, they bring blood pressure back to the normal, and thus our blood pressure, it is regulated. This is the Raas system, how it operates. Okay, so there's a very common question: what happens when there is increased blood pressure? If the blood pressure will increase, renal blood flow will increase, which will increase the GFR, sodium load will increase, macula densa will stop the signals to the JG cells. When signal is stopped, the renin synthesis will be inhibited. When renin is not released, the whole cycle, it is going to stop. Hypertension में क्या होगा कि ब्लड प्रेशर अच्छा खासा होगा, ब्लड फ्लो भी ज़्यादा होगा, और जेजी सेल्स रेनिन को नहीं रिलीज करेंगी, और जब रेनिन रिलीज नहीं होगा, जो आगे का साइकिल है वो काम नहीं करेगा. One very important question that is asked from this Raas system is कि if this Raas system continuously keeps on working, what happens? If this Raas system continuously keeps on working, you see, it will cause increase in the blood pressure very high. Second important thing, it will cause increased sodium and increased water in the blood. अगर ये continuously काम करता रहेगा तो बॉडी में ब्लड प्रेशर बढ़ेगा, सोडियम ज़्यादा हो जाएगा, वो वाटर ज़्यादा हो जाएगा. टू बैलेंस दिस थिंग, what nature has done, whenever blood pressure increases, body releases a molecule that is known as ANF, atrial natriuretic factor. What is this atrial natriuretic factor? Atrial natriuretic factor क्या है? See, if the blood pressure is more, अगर blood pressure ज़्यादा होगा तो body में जो right atrium है और the chambers of the heart, the atria, they will be more stretched. There will be more stretch on the atria of the heart, and when the atria, they are stretched, when they are stretched, they release a molecule that is ANF. So ANF, it is released from heart. When this ANF, it is released, it inhibits the synthesis of renin. Okay, it inhibits the synthesis of renin, or it opposes the Raas system. How it opposes the Raas system? Just one word: natriuresis. Natriuresis is, natriuresis means natri sodium, uresis means urine. It is throwing off sodium in urine. Okay, so what this ANF does? Raas system was bringing back, what Raas system was doing, it was bringing sodium into blood. ANF, it throws sodium in urine, and thus what happens? Our blood pressure, it is checked from getting very highly elevated. Okay, so this is Raas system, how the Raas system it works. Okay, I hope the blood pressure regulation, short-term regulation and long-term regulation, both are clear to you. Okay, if you have any questions, you can ask me in the comment section. And there is a question for you, and the question is, there is a question for you, and the question is, what is juxtaglomerular feedback. And second question is renin hormone or enzyme? Try to find out the answers of these questions and let me know in the comment section. In our next video, we will be discussing hypertension and we will be discussing different disorders related to the Raas system. अगर आपको वीडियो पसंद आया, like the video and share with your friends. Thank you.